Okay, so first I want to say that I do not own any images used in this video. Do not own any images. Okay, so with that being said, for us getting started for the skin disorders, we want to know the different parts of skin, and at this point we should know. So first we have epidermis, we have dermis, we have the subcutaneous layer. Sometimes it's also called the hypodermis because it's below, HYPO below, and then EPI above. And yeah, it's vital to know these different sections of the skin. The skin is the largest organ we have and it's very absorbent. Now I'm going to talk about common skin lesions. First we have macule. Macules are flat, they're small, and they're a different color from the rest of the skin. You can find macules being associated with leprosy and lice. Next, we have nodules. Nodules are firm, they're raised, they're deep, they're elevated, and they vary in size. Some conditions you might see associated with nodule would be a furuncle or a boil. Next, we have papule. Papules are small, they're solid, they're elevated, they're small and firm. And some association or conditions that you may see associated with papules would be warts, or verrucae, or lice. Next, we have pustules. P-U-S, the pus, it tells you what's inside. The name tells you what's inside of the particular skin lesion. These are raised. They often have a head, as you see. Let me point to it, guys. Right there, you can see that yellow head. So pustules will often have a head. They're usually a red, and they have purulent expedite, which is pus. Okay. Next, we have vesicle. Vesicles are like blisters. They're thin. The thin wall is thin. They're raised. They're fluid filled, and the fluid is clear. Okay, it's essentially a blister. In some conditions that are associated with vesicles would be scabies, herpes, Pemphigus, contact dermatitis, and impetigo. Next, we have plaque. Plaque, they're slightly elevated. It has scales. It's like scale-like because it's topped with scales, as you see. It's like white scales. A condition that is associated with plaque is squamous cell carcinoma. Next, we have an ulcer. Ulcer is a cavity or a hole in tissue, and it's essentially the loss of tissue. And because it touches or it can cause damage to the dermis or the subcutaneous layers of skin where our vessels are, it can weep and bleed. Next, we have fissure. A fissure is a small crack in skin. So today we're going to talk about skin disorders and skin inflammation. So first we have pruritus. Pruritus is like the itchiness of skin. So when your skin is really, really itchy. Pruritus can be caused by allergy responses, chemical irritation such as like insect bites, parasites like lice and scabies, can be caused by the release of histamine, milk stimulation of pain receptors. And then we have how it looks. It's presented with redness and itchiness because that's what pruritus is, itchiness. And also the infection happens as a result of scratching an infected area. So it just spreads rapidly. Some diagnostics tests that you can use to diagnose pruritus would be a bacterial CNS, which is a urine and culture sensitivity test. A biopsy is when you take part of the skin and you test it in the lab. And then the release of antihistamines and glucocorticoids is a part of the treatment, as well as the soaking and compressioning of the skin is part of the treatment for pruritus. Contact dermatitis. This is a type 4 hypersensitivity reaction. I'll touch more on hypersensitivities in another video. So the signs and symptoms of contact dermatitis is allergic dermatitis. You have a pruritic area, which is like a fluid-filled area, red skin, edema, And often you will see like these small vesicles, which we'll talk about in another video. Chemical irritants would be like edema and red skin, and it's very painful. That's contact dermatitis. Now we have urticaria, which is also known as hives. It causes a type 1 allergic reaction or type 1 hypersensitive reaction within the body. This is where hay fever occurs. This is where the IgE immunoglobulin binds to mast cells to release histamines. One common way that a person contracts this hypersensitivity is through ingesting some type of substance. So some signs and symptoms would be, of course, histamine release leads to these particular things happening within the body: hard raised lesions that are scattered all over the body, known as wells, and high pyloric lesions. And some ways to treat this condition is through antihistamines, because the histamines are causing massive problems within the body when the substance is ingested. Next, we have verrucate, which is also called a wart. It's caused by HPV, human papillomavirus virus. There's different types. So starting with HPV 1 through 4, that causes a common plantar or foot wart. And then we have HPV 6 to 11, causes genital warts. And then we have HPV 16 through 18, that causes cervical cancer. The virus sheds on the skin surfaces, and some signs and symptoms of warts would be a papule that is solid and raised without a distant margin, a rough surface. It develops a rough surface. It could be white or tan, and often there's multiple of them, and it's painful surfaces. Okay, next I'm going to talk about Scleroderma. It is a skin disorder. It increases collagen deposits in arterioles and capillaries, and it reduces blood flow to the skin or internal organs. Some of the signs and symptoms of Scleroderma are as follows: it's hard, shiny, tight, and movable areas of the skin. Their fingertips are narrow and shortened, and the Raynaud, which is the numbness of a body part, in particular the fingers, usually the fingertips. Facial expression is lost as the skin tightens, and movement of the mouth and eyes can be impaired. Here's an example of Scleroderma. Impetigo. Impetigo is a skin condition that is commonly found in infants and children. It's highly contagious and is a significant threat in hospital settings like neonatal units. Some risk factors of impetigo is low blood circulation, immune suppressant, open wounds / cuts, wet and damp clothing, and drug use. Now, the main causative agent of impetigo is S. aureus or Staphylococcus aureus, and sometimes it can be Streptococci. Impetigo can cause a deeper infection, such as cellulitis. We'll talk about cellulitis in a little bit, scarlet fever, psoriasis, and different bacterial infections. It's easily spread by contact with the infected fomites, usually by hands or direct contact, like eating utensils, using equipment such as towels, etc. So this is what impetigo looks like. So some signs and symptoms of impetigo would be lesions, small vesicles. They range from the color of yellow and brown crushing masses. They're underneath the crust vesicles from the lesions, and sometimes they're red and moist with brown colored exudate. It's very itchy, very irritating to the children. And this disease is also called hand, foot, and mouth. And that, of course, if it is located on the hand or foot or the mouth, but if not, then people would usually say impetigo if it's located at another area or something. Some treatment for impetigo would be antibiotics, oral or topical, warm compressions to move the exudate, and to get the topical medication inside of the wound, and some lab tests that we want to that can help diagnose impetigo would be a CBC, a bacterial culture, and impetigo. Next, we have acute necrotizing fasciitis. It's a flesh-eating disease, and it results in the reduced blood supply to the tissues. Pathophysiology behind acute necrotizing fasciitis is that it's a mixture of aerobic and anaerobic microbes, primarily as pyrogens, which is also the agent responsible for strep throat. It causes severe inflammation and deaf tissue. Signs and symptoms of acute necrotizing fasciitis is that the infected area will appear inflamed. It will be very painful to the patient. It will increase in size, and you will see dermal gangrene, which is tissue death. Manifestations are fever, tachycardia, hypotension, mental confusion and disorientation, and possible organ failure. Some treatment of necrofasciitis would be aggressive antimicrobial therapy, fluid replacement, removal of the infected tissue, treatment with high O2 hyperbaric chambers, and the possible amputation of the tissue of the infected area. Next, we have Scleroderma. Scleroderma is an infection of the dermis and subcutaneous layer, and it usually arises due to a secondary infection like a boil or ulcer. The causative agent is S. aureus, that's Staphylococcus aureus, and sometimes Streptococcus can also cause cellulitis. It usually occurs in the lower trunk and legs in individuals with restricted circulation and in the extremities. So that would be like a person who is bedbound or a person who can't use their legs, or a paraplegic person who's in a wheelchair. So those who have immune compromise as well are more prone to get cellulitis. So pathophysiology behind cellulitis is that the skin population is usually on the surface or below the skin. The organism multiplies and it triggers an immune response in our system. It will occur as a result of the presence of the organism itself, or as a reaction to the toxin produced by the pathogen. As we talked about, the pathogen cause for cellulitis was S. aureus. Some signs and symptoms of cellulitis would be a red area, it would be pain, it would be swollen, it would be red streaks coming down the lymph vessels proximal to the infected area. Some treatment of cellulitis would be antibiotic and pain medications. And one more thing to mention about cellulitis is that it is also considered an HAI, hospital-acquired infection. So atopic dermatitis, also known as eczema, it affects the flexor surfaces of the body, which would be like your hand and your legs. It is a genetic component, means that it runs in the family. It's chronic inflammation, responds to allergens. So we have the IgE that will be involved in this particular reaction. It is complicated by secondary infections. And that's if you already have an occurring infection, it's complicated by secondary infections. It's aggravated by irritants and also environment changes. So some of the signs and symptoms of eczema will be different from adults versus children. In infants, you'll see a pyloric, moist red or vascular crust. And then in adults, you will see a dry scaling, leather-like folds, and it will be in their skin. It will be moist and it will be red. And that's eczema. Psoriasis is a chronic inflammation skin disorder. It's genetic origin, meaning that it runs in your family. It's less common in individuals with darker skin. It begins in your teenage years usually. It remisses and it gets worse, or it gets better and then it gets worse. It results from T cells and cytokines increasing, which causes the proliferation of keratinocytes, which leads to the thickening of the dermis and epidermis. It has a silvery plaque over the red area, as you can see. This is psoriasis. Some of the signs and symptoms of psoriasis are as follows: red patches of skin covered by silvery scales, as we saw, dry cracked skin, possible bleeding, itchiness, burning, or soreness. It's followed by thickness, pitted or rigid nails, or swollen, stiff joints. Psoriasis. Next, we're going to talk about Pemphigus. It's an autoimmune disease that causes blisters. There are two types of Pemphigus. There is the Pemphigus vulgaris, it causes mouth sores, blisters on the skin. It's painful and it's very itchy. And then Pemphigus foliaceus occurs 30%, which is in the upper part of the epidermis, and then Pemphigus vagularis occurs about 70%. And one thing we want to know about Pemphigus foliaceus is that it doesn't have any mouth lesions or mucous membrane involvement. Okay, now we have fungal infections. Fungal infections can also be called tinea, and tinea can cause several superficial skin infections. And of course, there are different types of tinnias. There's tinea capitis, which is affecting the scalp, the ringworm of the scalp. It creates a circular bald patch and also red, like the flaky part on the scalp. And then we have tinea pedis, which is athlete feet or athlete foot. It's inflamed and it occurs between the toes of the skin, and it creates a foul odor. And next we have tinea unguium, which causes a nail fungus or a condition called onychomycosis. Next we have scabies. It can be defined as an invasion of a mite, and what the mite does is create a barrel, which is like a subcutaneous tunnel where they lay their eggs there. And so once the eggs are laid, the larvae emerge from the eggs and they migrate through the skin, and so they have this burrow or this tunnel that they use to lay their eggs in, and the cycle repeats. So some signs and symptoms of scabies, which is redness of the skin and the barrels, they appear as they're very tiny, and they're like little light brown lines, okay? And they often come with small vesicles or blisters. Inflammation will follow, and also pruritus, which is the itchiness of the skin. Next we have pediculosis, also known as lice. So it can take on 3 forms in the human body. That's the body, the pubic, and the head, which is known as the cooties. The lice feed off of human blood. They lay eggs on the hair shaft, and the nits, which are their eggs, are small, they're white, and they attach to hair. They also hatch and they bite the host. Some signs and symptoms of lice, you will see them. It will be very visible, and typically it's not visible in adults, but they will form macule or papules, which are skin lesions. They're highly pyloric due to the saliva, which means that it's really, really irritating to the skin. It's itchy from scratching. And some information to add is that lice are small brownish parasites. They feed off of human blood. But parasites that are common in animals are not the same parasites that are common in humans. Next, we're going to talk about skin tumors. First up, we have keratosis. These are benign lesions. They also associated with Asian or skin damage. Seborrheic, which is the proliferation of basal cells, which also causes over elevation. It could be smooth or rough, and they're often dark in color. Actinic, which is when the skin is exposed to UV radiation, and it often occurs commonly in fair-skinned people. The pigmentation is scaly, and it can be squamous cell carcinoma, which we'll talk about in the next slide. Next, we're talking about squamous cell carcinoma. These are painless malignant tumors of the epidermis. It's frequent in exposed areas of the skin. Smokers have a higher incidence in the lower lip and the mucous membrane of the mouth. And some signs and symptoms of squamous cell carcinoma would be scaly, slightly elevated reddish lesions, irregular borders. You have a central ulceration going on. It grows slowly in all directions and invades the lymphatic system. Next, we have malignant melanoma. This develops from when the melanocytes act up, and it depends on genetic factors, UV radiation exposure, and different hormonal imbalances. It's often multicolored with irregular border. It grows quickly. It extends into the tissue where it metastasizes really quickly. And there's an acronym, a little something to help us remember, or to figure out the signs of malignant melanoma, which we call the ABCDs signs of melanoma. And A stands for the area of the mole, if it's increased or not. B stands for the border, which is irregular. C stands for the color has changed. And D is for the diameter of the mole is increased. So if you see these signs, it's usually probably most likely malignant melanoma. Next we have Wrinkles, which are essentially boils. This is an infection that is caused by Staphylococcus aureus, which is a microorganism. It begins at the hair follicle and spreads to the dermis. And then some of the commonly affected areas is the face, neck, and back. Some signs and symptoms of Wrinkles would be firm rate lesions, painful nodules, and abscess, which produces large amount of prudent expedite, which is known as pus. Pathophysiology behind boils is that a series of immune responses are beginning with the migration of white blood cells to the infected area and the separation of fluid-filled cavity from the surrounding healthy tissue, and it ultimately forms boil. Treatment of Wrinkles would be antibiotics, analgesics, which are pain meds, warm compression, which promotes drainage, and if the drainage doesn't go away on its own, a doctor may be consulted to perform a procedure called I&D, which is incision and drainage, to get rid of the abscess and expedite that's inside of the boil. Next we have leprosy, which is called Hansen disease. It's caused by a microorganism called Mycobacterium leprae. It causes skin lesions and nerve damage. It's not highly contagious anymore, and it's very rare in the United States, but it is endemic to Africa, Asia, the South Pacific, and some areas of South America. So some signs and symptoms of leprosy would vary. You would see macules. You will have nerve damage, so that means that the patient probably will have loss of feelings in certain areas. It affects mostly the eyes, the skin, and the nose. Some treatment of leprosy would be mostly drug therapy or antibiotics. Herpes simplex virus. There are two types, type 1 and type 2. Type 1 is responsible for causing cold sores. The primary infection may be asymptomatic, meaning that the person may not be aware that they're affected with the virus. The virus remains in a latent stage in the sensory nerve ganglion of the trigeminal nerve, which is the fifth cranial nerve, and it reactivates due to extreme cold or extreme hot weather, and even stress can activate type 1. It's spread by contact with fluid of a lesion. So if someone has herpes and you drink from them, then you can also contract herpes simplex virus 1. Some signs and symptoms of type 1 would be a burning, tingling along the nerve and the lip site, and development of vesicles, which are blisters. They rupture and they form a crust, and they usually heal within 2 to 3 weeks. Herpes simplex virus 2. This is the main cause of genital herpes, which is an STI, sexual transmitted infection. And then herpes zoster, which is the cause of Asian and shingles. And they are not related. They're just in the same family. And herpes zosters, they are not STDs or STIs. Some signs and symptoms of of type 2 would be a tingling sensation around the infected area and vesicles. Just the signs and symptoms are very similar to type 1. So I guess it would be like an area thing. So you would have the tingling sensation around an infected genital area. And there would be these painful red blisters.